Good day everyone, I am CPC-Comonal from BSN1 11K, and now I am going to perform or conduct a skin assessment. Skin is the largest organ of the body. Skin and its derivatives, which include the hair, nails, sweat, and oil glands, make up the integumentary system. This is also called the integument, which means covering. Covering indeed, as it acts as a physical barrier that protects us, protects our underlying tissues and structures from microorganisms, physical trauma, ultraviolet radiation, and dehydration. And it plays a vital role in temperature maintenance, fluid and electrolyte balance, absorption, excretion, sensation, immunity, and vitamin D synthesis. And there are some certain diseases or illnesses that can be or often manifested through our skin. So that's why we need to take care and assess our skin. Okay, now before we jump in the introductory phase, it is important to remember and know that we need to review the medical record of the patient before meeting the patient. This enables us to know the basic information of our patient and the scope of the assessment needed. This is actually the pre-introductory phase. And next, or including in this phase, is preparing the necessary equipments. So I already have prepared here a functional pen and the recording sheet for recording the information and for taking notes, and a pen light for lighting so that I can clearly see or for better viewing of the skin of my patient, and a non-sterile glove since I will be touching the skin, hair, and nails of my patient, so I will be needing this to avoid cross-contamination, and of course an alcohol for disinfection. And now that we have prepared all the needed equipment, so next in this phase is performing hand washing. So prior to the conduct of the assessment, I have already performed thorough hand washing. Okay, now I am good to go to meet the patient, which is actually the introductory phase where I greet and introduce myself to the patient, verify the patient's identity, and explain the procedure or the things that I will be doing, and ensure patient's privacy.
Come in.
Okay, good afternoon, sir.
Good afternoon.
Okay, I am CPC-Comonal, your student nurse for today. Okay, how are you feeling?
I am good.
Okay, that's great. Okay, now please state your complete name.
Roberto Zaragoza Comunal.
Okay, and your birthday.
August 23,
Okay,
1966.
thank you very much, Mr. Comonal. How would you like me to address you?
Just call me Bird.
Okay, Bert, I'm going to assess for your skin, hair, and nails. And for me to be able to do that, I'm gonna have you to remove your clothing later. But don't you worry, I'll be providing a gown for you to change into, because we're gonna have to expose some of your skin, and I'll be touching those parts. So I will be touching your skin. Would that be okay with you?
Okay.
Okay, and I assure you that all the information that I will be gathering here about you, the confidential information, will remain confidential between me and the attending physician that I will be referring to. Okay, so now I'll just make sure that the door is closed for your privacy and for us to be free from any distractions. Okay, the door is closed. Okay, now please don't hesitate to ask if you have any questions or clarifications, okay? So actually, Bert, before we do the assessment, I'll be needing to ask some questions regarding your current skin conditions. Would that be okay with you?
Okay.
Okay, and before we start, what is your preferred language to communicate? Do you want me to speak in a different dialect?
Just speak in English.
So I have your permission that I'll be continuing to speak with you in English. Okay? So before we start, is there anything else that you want to ask or clarify?
No.
Okay? So, first question, have you noticed any reddened areas on your skin lately?
No.
Okay, how about unusual darkening or lightening on your skin?
No.
Okay. Have you noticed changes in the condition or appearance of your nails?
No.
How about hair loss?
My head.
So you are experiencing hair loss in your head.
Yes.
Okay, so now I'm going to ask about your past health history. So have you had any previous problems regarding with your skin, hair, and nails?
No.
Any history of skin cancer?
No.
Okay, and how about any allergic reactions? Do you have any allergies?
No.
In medications?
No.
Okay, in foods or pets?
No.
Okay. Okay, now I'm gonna ask about your family health history. So did anyone in your family have ever experienced or suffered from any skin problems or skin cancer?
No.
Okay. And now for your current lifestyle, how long do you expose yourself from the sun? Usually how many hours?
3 to 4
Okay, 3 to 4 hours of sun
hours.
exposure. Okay, so when do you go out to the sun? Do you apply or wear sunscreen?
No. I always wear jacket.
Okay, alright. Bert, it is important to apply or wear sunscreen to prevent skin cancer even though you are wearing jacket all the time. It is that important, okay? Okay. Okay, now how about exposure to chemicals? Do you use lotions or any other skin products?
Lotion.
So you are using lotion. And is that for hydrating, moisturizing, or skin whitening?
Skin whitening.
Okay, skin whitening. Okay, do you have any daily routine for your skin, hair, and nails?
I take a bath every day.
Okay, you take a bath. That is your daily routine for your skin, hair, and nails. Okay, and what do you usually eat in a typical day?
Rice,
Okay,
egg, vegetables, seafoods, and fruits.
yeah, that is great to hear that you eat vegetables every day and you've also incorporated fruits in your meals every day because that is actually healthy for your skin, hair, and nails. Okay, and at home, is everything all right? No stressors?
No.
Okay, that is actually all the things that I want to ask from you. And now to start the assessment, so I'll be asking you to remove your clothing, and here is the gown that you'll be changing into. And also I'll be asking you to remove any jewelry such as wristwatches, necklace, earrings, and rings. Okay, then I'll be seeing you when you're done changing. Okay. So now while the patient is changing, so we're gonna make sure that all the curtains are down and all the windows are closed. Okay. Okay, all the curtains are down and all the windows are closed, and I already closed the door earlier, so the door is closed. And I'm gonna perform hand hygiene while waiting for the patient. So I can see that you've put on the gown, so thank you for that, Bert. So are you ready now, or are you good to go for the assessment of your skin?
Yes.
Okay, so I'm gonna go ahead looking at your skin, inspecting your skin. So first I'm gonna have to position you. So can you put your legs up here, both of your legs? Okay, straighten them up, and you can lay back if it's uncomfortable for you to stay up when your legs are up here. Okay, that's good. Okay, now I am looking at your skin color overall, starting from your face, okay, and your arms, and down to your legs. Okay, what I am looking for here is if there's any abnormalities, such as abnormalities or discoloration, such as powdery or paleness, cyanosis, that would be blue, erythema, that would be red, and yellow for jaundice. So I can see that you have a consistent skin, okay, no unusual discoloration, and you have an even pigmentation on your skin, so you don't have a darker or lighter areas. And you don't have a blue and red pigmentation or color on your skin, and you also I don't see any yellow color or pigmentation for jaundice that could indicate that you may have a liver or gallbladder or pancreas problem. And I am not also noticing any unusual odor coming from you or emanating from your skin, because it is important to remember that while we are inspecting for skin coloration, we need to take note if there's any odor emanating from the skin of the patient. Okay, now continuing for the skin assessment. So I'm gonna have to touch the skin of the patient because I will be assessing first for the skin moisture. Okay, Bert, now I'm gonna touch you starting from your upper extremities and your lower extremities. Okay, your skin moisture, I can see that it is dry, which we need to take note of that because dry skin could indicate dehydration or excessive use of soap. Okay, now I'm gonna assess for your skin temperature. Okay, it is warm, which is normal. Okay, and as you can see, as I am assessing for skin temperature and the skin moisture earlier, I am using the back of my hands or the dorsal surfaces of my hands because it is believed that using the dorsal surfaces of our hands measure accurate result for obtaining the temperature and moisture of the skin. And also, inflammation in tissues of the skin could change skin temperature. That's why we need to assess for skin temperature of our patient. And now, I'm gonna assess for skin texture. Okay, in your arms. Okay, it is smooth, even, and thin. Okay. Both in your wrist and on the sides of your hands or on the sides of your palms is a bit rougher than your arms. This is because of his scoliosis that is exposed to constant pressure. Okay, so your skin texture is smooth, even, and thin, which is normal that his skin is this thin because actually the only places in our body that has a thick skin is on the palms of our hands and on the soles of our feet. For skin texture, I've used the palmar surfaces of my 3 middle fingers. Okay, now I'm gonna assess for your skin mobility and turgor. So here I'm gonna assess for your skin mobility and turgor in this area of your chest. So what we are expecting here, or what I'm expecting here to see, that when I pinch this area of his skin, it should be easily pinched, or it should move easily, and that would be normal mobility, and it should go right back to normal or go right back into its place, and that would be normal turgor. Okay, mobility, how easily the skin is pinched or moved, and turgor is how easily the skin goes back right into its place. Okay, mobility, turgor. Okay, mobility, turgor. Okay, I can see that your skin is pinches easily, or it moves easily as I pinched it, and so that indicates that you have a normal skin mobility. And since your skin goes back right to its shape quickly, so that indicates that you have a well hydrated skin, or you have a normal skin turgor. Okay, now I'm gonna assess for your skin, or if you have any lesions or edema. Okay, starting from here, your chest. Okay, I don't see any lesions here, Also in your arms, I don't see any lesions or healed scars. But I see moles in different sizes and mostly in the same color from light brown to darker brown. And I don't see anything larger than 6 millimeters, so I don't see anything of concern. So here in your legs, I don't see any lesions, but you have a healed scar here. So what caused this, Bert?
Bicycle accident.
So this healed scar on your beneath your knee is from a bicycle accident. So aside from those, I can also see some visible moles here, and there isn't anything that larger from 6 millimeters. So everything's normal. And now we're gonna assess for or palpating for edema. And to do that, I'm gonna use my thumb to apply pressure on the patient's feet, because what we want to see here for a normal finding is that the skin should rebound, or there should be no indentations left on the skin or on the feet of the patient. So Bert, can you move back a little bit so that they can see? Okay, now I'm gonna apply pressure using my thumb. I'll just use this. Okay, now I'm gonna apply pressure using my thumb. Okay, there is no indentations left on the skin or on the feet, so therefore there is no signs of edema. Okay, so we can position these facing here. Okay, thank you very much. And now perform hand hygiene. And for assessing the hair, I'm gonna be needing to wear a gloves, because for any lesions or for any manifestations or parasites, so we don't want that to touch our hands. So now I'll be okay, put the gloves on. Okay, now that we have put our gloves on, so we are good to go for assessing the hair. First, Bert, I'll be asking you to remove any hair clips, hair pins, or wigs if you are wearing any.
None.
Okay, so now I'm going to assess for your hair. So I can see that you have a mix of black, gray, and white hair. So it is important to remember that in inspecting or assessing the hair by 1 inch intervals. So we are separating the hair by 1 inch interval. And specifically what we are doing in the hair assessment is we are inspecting, palpating for cleanliness, dryness, oiliness, and manifestations or parasites and lesions. Okay, so I can see that your hair is smooth and your hair distribution is symmetrical, and you have a typical man pattern, baldness, but that is expected. And your hair is clean. There's no parasites or dandruffs or lice. Everything looks completely normal. So that's it for assessing the hair. And now that we are done, so I'm gonna remove the gloves and properly dispose disused gloves in a proper receptacle. Okay, now I'm gonna perform hand hygiene, of course, before proceeding to the next part, which is assessing for the nails of our patient. So Bert, now I'm gonna be assessing for your nails. So may I have your hands, please? Okay, first thing is to inspect for the nail grooming and cleanliness. So I can see that your nails are clean and well manicured. Okay, and next inspect for the color and markings of the nail. So it is pink toned, which is what we want to see, and also there are no markings, so it is normal. And next is inspecting for the nail shape, okay, which should be a 160-degree angle between the nail base and the skin. So I can see that the patient's nail is less than 180 degrees angle, so therefore there is no clubbing. And now I'm gonna palpate the nail for assessing the nail texture. So by pressing, so I can see that your nail is hard and firm, which is the nail plates is firmly attached to the nail beds and it is basically immobile. And then nails are smooth. Okay, and now or next we're gonna test for the capillary refill of the nail beds by pressing the nail tip briefly and watching for any color change. Okay, capillary refill is usually indicated by the immediate return of the pink tone on your nails, and it is normal within less than 2 seconds. Okay? Okay, now perform hand hygiene and summarize all the things that you have noted and let the client know of the result. Okay, Bert, we are actually done with the assessment, and what I want to do now is kind of go through all the things that I've noted and summarize for you. This is the information that I'll be taking to the attending physician. Okay, your skin is consistent with even pigmentation, no lighter or darker areas, and no blue, red, and yellow pigmentation on your skin. Skin moisture is dry, skin is warm to touch, skin texture is smooth and even in most areas and only feels rough on wrists and sides of the hands. Skin can be pinched easily and returns to its original shape quickly, indicating normal mobility and turgor. So no indentations in the feet, therefore no signs of edema. Hair is mixed with black, gray, and white. So hair distribution is symmetrical and it is clean, no lesions or lice and dandruffs, and hair is smooth. And nails are clean and well manicured. Color and shape of nails are normal. Nail texture is hard and immobile, smooth and firm. And the capillary refill is less than 2 seconds. So Bert, do you have any concerns, questions, or clarifications?
No.
Okay, so this is the information that I will be taking to the attending physician. And thank you for your cooperation. And we will be calling you. We will be letting you know if you will be having a follow-up test or interview that you will need to take. Okay?
Okay.
So now I'm gonna head out. You can now change, and I'll see you then next time. Thank you very much.
Welcome.